So we're not sure when many of our cases were infected, but I think we do know that in Australia now there are well over 50,000 men, mainly men and some women, who are carrying the virus, who in time carry a significant risk of developing AIDS.
In 1984, I was one of the first group of people to be diagnosed with HIV. So it was pretty devastating because back in those days, it was a death sentence.
St Vincent's was in the epicentre of where it was all happening, no question. And to a degree still is.
We were always behind the 8 ball, right? There were always too few beds and too many patients who were sick. The Sisters of Charity at the time were very brave to insist that patients should be cared for here according to the philosophy of the sisters in the provision of health care to people no matter how they became ill.
We had nothing to treat the virus with, so we could treat the complications, we could treat the symptoms that the patients were suffering to varying degrees, but we had nothing to reduce the virus.
It was rare for a person to have one problem. They all had 2 or 3 or 4 medical problems, and it made their care very complicated.
In those days, the word homosexual was unmentionable still, almost. People didn't talk about it. It was something that you didn't discuss. And so a lot of our patients had parents who they had to come to terms with the fact that their sons were dying and that their sons were gay.
I was terrified because of that attitude of people out in the general population. So coming in here, it was like a refuge, it was like a sanctuary.
And it meant a huge amount to our patients in that they'd been fearful of going to hospital. There were stories in the paper of their meals being left in the corridor, nurses not wanting to touch them. And finally there was a unit which was built on compassion.
Our attitude was non-judgmental. Our attitude was one of loving the person and no judgment, no condemnation.
So to have an organisation, St Vincent Hospital, the nuns, commit to this and establish such an excellent service, which the doctors and nurses were proud to work at. We sent such an important message around the country for tolerance and understanding.
It was a very compassionate atmosphere, and they were very relaxed about visiting ours. I remember taking friends that were visiting from New Zealand into seeing dying friends at midnight. They didn't mind, it was cool.
One of the high points of the whole episode was the support that we had from the sisters and the hospital administration, as well as the governments of the day, and being able to set things up and get appropriate funding to look after these patients.
We met with the then Premier Neville Wran, and we received $2 million towards the establishment of the new immunology centre, and we had fundraising activities to raise money to expand that.
HIV research and ongoing treatment continues to be a priority for St Vincent's. We're doing some really exciting work in trialling new drugs, in post-exposure prophylactic treatment, but also looking at new and emerging treatments for people with HIV.
Good afternoon and welcome to our commemoration for World AIDS Day 2021 at St Vincent's Hospital, Sydney. My name's Linda Newton from the St Vincent's Curran Foundation, and it's my pleasure to be emceeing this webinar. I begin today by acknowledging the Gadigal people of the Eora Nation, the traditional custodians of the land on which St Vincent's Hospital is built, and pay my respect to their elders past, present and emerging. I acknowledge our hosts who are joining us today and watching live, Associate Professor Anthony Schombury AM, Chief Executive Officer of St Vincent's Health Network Sydney, and Shanthini Naidu, Chief Executive Officer of the St Vincent's Curran Foundation, as well as members of our St Vincent's Executive and Board, and in particular the Sisters of Charity who are joining us today. We planned this as our first post-lockdown event live, but unfortunately, like everyone else, we had to modify our plans due to COVID. But St Vincent's is very good at being flexible, and having to change an event is nothing compared with having to deal with a pandemic. HIV was the last pandemic that hit the world like a sledgehammer in the early 1980s. I remember when I first learned exactly what it was. The kitchen hand in the restaurant where I was waitressing after I left uni, a lovely, funny man who kept our grumpy chef on track with his humour, suddenly got sick. We didn't know what was wrong with him, we didn't understand, and then suddenly he was dead. The first of many colleagues, friends and friends of friends who died from AIDS. As you've just seen, and as you know, St Vincent's was at the coalface of the epidemic in Australia, and it's thanks to the dedication and collaboration of so many of our researchers and clinicians, and the courage of so many patients who undertook experimental trials and drug tests, that being HIV positive went from a certain death sentence to a manageable condition. It's my pleasure and privilege to introduce someone who's been at that coalface since 1989, the Director of HIV and Immunology at St Vincent's Hospital, Sydney, Professor Andrew Carr. Andrew will provide an insight into the journey of nearly 40 years of HIV/AIDS at St Vincent's and what might be ahead. So thank you, Andrew.
Thank you, Linda. I'd also like to acknowledge that I'm speaking and working on Gadigal land. Please don't adjust your set. I'm not Anthony Schombury, who couldn't be here at the last moment. So by virtue of being the director of the HIV service here and having some experience, having joined in 1989, I've been asked to make a few observations about 40 years of HIV. So 2021 marks the 40th anniversary of the first reports of AIDS in July 1981. And the subsequent 10 years saw the emergence of a global epidemic that has so far caused 79 million infections and 36 million deaths. Locally, under the leadership of the Sisters of Charity, David Cooper and Ron Penny, we saw the opening of the AIDS ward here on Carl 7 South in 1984, which went from a standing start to 36 beds by 1990. And in tandem with that, a lot of clinical and laboratory research. We saw the first HIV drugs, which were fairly weak and fairly toxic, but didn't deter people from pursuing a lot of drug development. 1988 gave us a graphic that was labelled Silence Equals Death. And this was a graphic with a pink triangle that was based on imagery from 1930s Germany and its policy of discrimination against gay men. On a more positive note, 1988 also gave us the first World AIDS Day. In 1989, I arrived here for what I thought would be 3 or 4 years of immunology training, so that's what I knew. The next 10 years brought us combination treatment of HIV, and from the end of 1996, we saw the HIV ward empty out, and fortunately, it's never filled again. The 2000s brought us much better treatments, and by 2009, I believe, we had the first treatment of 3 medications in 1 pill once a day, which for a disease that needs lifelong therapy was a huge incentive for patients to take up treatment. The 2000s also saw the opening of IBAC here as a dedicated HIV outpatient space. The 2010s gave us 3 landmark clinical trials. Firstly, that early treatment soon after diagnosis reduced the risk of AIDS and death. And this early treatment has resulted in the life expectancy of the average Australian with HIV being almost normal, as opposed to a 10-year life expectancy from infection and a 2-year life expectancy from the diagnosis of AIDS back in the 80s. So it's given people an extra 40 to 50 years of life. We've also had the notion of treatment as prevention, whereby treatment of a positive person meant that they would not transmit HIV to their babies or to their sexual partners. And thirdly, some of the HIV treatments have been used as what's known as pre-exposure prophylaxis, so to prevent the acquisition of HIV. With much HIV care rightly moving to the community and general practice, IBAC has focused mostly on those who are more marginalised and harder to treat, such as those with multiple chronic health issues, including mental health problems, as well as issues relating to drug use and drug abuse. We've also expanded our service into the prevention and treatment of anal cancer, which is very common in HIV-positive gay men. The 32 years I've been here, I suppose, has given me really a wonderful privilege from which I'm always grateful. And I've got patients I've been, privileged to care for now for over 30 years. In terms of the future, HIV won't go away, although one day I will. But when I do, I'm very confident that there'll be a new generation of clinicians here able to care for our patients in the decades to come. If I may, I'd like to conclude with sort of a few observations about some of the spin-offs of HIV. First, speaking as a straight white man, and so perhaps not the best person to make the comments, it seems to me that the political mobilisation of mostly gay men with HIV in the 80s propelled significant positive social reforms, such as the decriminalisation of homosexuality and more recently the legalisation of same-sex marriage. Medically, the lessons from HIV drug development resulted in much more accelerated development of treatments for hepatitis C, which is now easy to cure, for hepatitis B, which is easy to control. And it's no accident that the first treatments for COVID are coming from companies with experience in HIV drug development. And I think it's likely that we'll see better COVID drugs fairly soon, perhaps taken in combination. So for all the death and the suffering that we saw in the 80s and 90s, there has been developments come out of that are very positive for us today. Thanks very much.
Thank you, Andrew. It's a real honour to work with such inspiring and committed people like you, Andrew, and who are not only leaders in their field, but who continue to champion the mission of the hospital and the Sisters of Charity in helping the poor and the vulnerable. St Vincent's continues its commitment to provide the best health care for all, particularly for those who may experience prejudice and discrimination or who may feel potentially vulnerable in a healthcare setting. To talk about a St Vincent's initiative that supports our LGBTQ staff and community members, I'd like to welcome Dr. Chris Robinson, Executive Director of Innovation and Improvement, and Brandon Baer, the Inclusive Health Project Manager at St Vincent's Health Network, Sydney. It's over to you, Chris and Brandon. Thank you.
It'd be fantastic. Thanks, Linda. Look, I think before I jump into this, it is it's a huge honour to be able to speak today at World AIDS Day at St Vincent's, following the words of Andrew Carr, who so eloquently described the journey that we have been on in the management of HIV and AIDS in Australia, globally, and here at St Vincent's. And I think, when you get to work with the likes of Andrew and in sort of in the environment and legacy of the likes of David Cooper and Ron Penny, as a very proud gay man, it is truly humbling because it is the work and the tireless efforts that was put in by those who came before that has meant that we can reflect on the amazing journey that we have all gone through in the management of HIV/AIDS to be really something that is extremely manageable in the community today. So I just wanted to say that before we kick off. So, as Linda said, my name is Chris Robinson. I'm the Executive Director of Innovation and Improvement, and I am also the Executive Sponsor for our Sexuality and Gender Diversity initiatives here at St Vincent's, which is maybe sounds like a little bit of a strange title, but it is something that I think is extremely important. I'm going to tell you a little bit about why I think it is so important, and it's why it's so personally important to me. And then I'm going to hand over to Brandon to tell you a little bit about Pride at St Vincent's Health Network, which is something that we are extremely proud of and extremely excited for. And we want to say thank you to the Foundation for their support over the last sort of 12 months and into the future with our initiatives. So why is a Pride Network so important to me personally? So when I was a junior doctor not too long ago, I was working at another hospital who shall be unnamed, and I remember being absolutely terrified that I would be identified as gay. I grew up in a small country town where everything that was gay was bad, and I remember it was one of my first days as an intern. My registrar on a surgical team described one of the patients that we were caring for who had had a traumatic brain injury as the gay patient. And it was that sort of labelling in what I thought was quite a progressive environment, that derogatory sort of language and whatnot, that really made me sort of fly straight back into the closet, if you like. And I found that for my time over the next couple of years in that facility, I was never able to be my whole self. And did that make me less of a doctor, or did it make me less of a person? I'd probably not, but did it make me less comfortable in the workplace? Most certainly. Fast forward to me moving on to another role and in another environment where I joined an organisation that had a very, very strong Pride network. I was greeted in orientation by a presentation from the Pride Network, who spoke all about the initiatives that they were doing and talked about all the supports and things that were in place to really ensure that people felt, people who identified as queer, that they helped them to feel safe, helped them to feel connected with the organisation, and helped them to bring their whole self to work every single day. And I think when we reflect upon the words from Andrew just previously, that during HIV, one of the things we saw was that silence equaled death. I think being able to put initiatives in place that allow people to speak up, to be themselves, and to feel that their voice and their person matters is really, really important, not just for HIV/AIDS, but for everything. So fast forward a few more years, and I was leaving that organisation and preparing to start work at St Vincent's, and I reflected on the impact that the Pride Network had had on me in my work at my previous employer, and it was something that I was really afraid to lose. And I knew that I was coming to a Catholic hospital, and I must admit I didn't know a huge amount about the legacy of St Vincent's at that time. And I was a little bit afraid. I was a little bit afraid that I would be thrust back into the closet. And I very soon found out when I started working here at St Vincent's and working closely with many of our senior leaders and many of the people across our organisation, that I got to understand the legacy and understand just how safe I was as a member of the queer community at St Vincent's, and just how accepted I was, but also just how strong the partnership between St Vincent's and the queer community was. And that kind of really sparked the drive in me to say, well, why don't we have a queer or a Pride network at St Vincent's? And fast forward to today, it's really exciting that we're here to talk to you on what is such a momentous day. And I think what I'll hand over to Brandon now, if you like, who's going to tell you a little bit about some of the things that we've been doing, some of our plans, and then we'll wrap up talking about some of the things that will come next.
Thanks, Chris. And look, I'll honour that and reflect on those, the amazing humbleness that I'm feeling today being part of this. The HIV journey in Australia and the queer journey of self-acceptance and self-determination are so intrinsically linked, and St Vincent's as a part of that. I've been in this role of Inclusive Health Project Manager for a few months, and it's been such a great pleasure to work with Chris and some amazing other people that I'll highlight in a minute to develop some structure around this network. One of the first things we did was come up with a purpose statement, which is to say that we exist to create a safe and inclusive space for all staff and patients. And I think that it's really important for us to reflect on the fact that the work we do internally with staff, the work we do on improving the workplace culture for those who we work with every day, definitely has an effect on those who we work for every day. An inclusive workplace is seen by patients, an inclusive workplace is respected, and we become a place where the queer community can feel safe. They know that we're working from the inside out and we're being very genuine and authentic in what we're doing. So in terms of our role as a healthcare service, not only do we have that responsibility to our staff, but also to the people who we're seeing each day. We welcome people of diverse sexualities and genders and people with intersex variations, and we also welcome allies. I think probably about half of our group are allies at the moment, so cisgender heterosexual people who are really interested in making this a better workplace. We welcome members from all of our campus teaching and research partner organisations as well, so anyone who's friends with us can come along and be part of this, as long as you're supporting our purpose and working together to achieve our goals. This is the strategic working group. One of the things we've done over the last few months is to as we've gotten an increasing number of members, which is very exciting, is to establish some working groups. And the strategic working group is essentially tasked with development and growth and making sure that we're going in the right direction and also being responsive to the members. Obviously, you've met Chris today, Sean Evans, Nicholas Smith and Courtney Lane, so 3 of the other strategic working group members. I think what this represents is a really good cross-section across some of the different areas of the hospital. Clinical staff, nurses, people who have expertise in a lot of different areas. And of course, having senior medical staff is always really exciting for us because that really shows that commitment from the top. And I must say that the membership of the Pride at SVHNS working group is becoming more and more diverse all the time. And that's what we really love to see. The purpose of our network is fourfold, and I won't go through all of these because I know we're on limited time today, but essentially what we're talking about is visibility, education, advocacy, and safety. And these 4 things really work hand in hand with each other. And they're also amazing and fun things to be involved in. You can see lovely Dr. Robinson's face there behind our marching group from Mardi Gras this year at the SCG. So we're already in planning for next year. The costume designers and music mixers are working hard to have just as fabulous a representation. And while this looks like a bunch of fun and a really great time, which it certainly is, there are, thousands of people in that audience at that parade every year, and they're seeing a really vocal commitment from St Vincent's to our communities. So the great thing about working in this space is that there is a lot of glitter and there is a lot of sparkle, but all of these things have such incredible meaning. That parade is a sacred space for these communities. It's about to celebrate its 44th iteration next year. It's an organisation I've got a lot of love and passion for. But it's so good to see the integration of our local and queer communities more broadly. We have our 3 kind of value statements, and very importantly to this group, we balance our legacy with our future. So the work of 17 South, not just that work, but the work of the whole hospital in our communication and collaboration with queer communities is tantamount and pivotal to the future work we're doing. And we're really excited about working with people to shift that focus. As I said, we make sure we're looking at the people that we're in our network and meeting their needs, but also sharing that information is very important to us. We've recently joined a community of practice for Pride networks from local health districts across Australia, and that's a really great example of how we're sharing some of our knowledge. This year, as 3 key highlights, we've worked on 2 days of significance and made them bigger and better than last year. So those of you who get the bulletin might have seen our Wear It Purple ambassadors. So Chris again was one of those. We had some great people from across our services. And then more recently, the Trans Awareness Week campaign, which was also saw the launch of a training package for our emergency department staff on working with trans and gender diverse patients that was co-designed and delivered with a trans consumer. We're currently working towards being benchmarked against the Health and Wellbeing Index, and I guarantee you all you'll be barraged with a bunch of new initiatives that have come out of that early in the new year. And obviously looking at growth, when I first came to the inaugural meeting, I think we had 12 members and we've just hit 60. I'm not very good at math, so if that's not a 500% increase, please yell at me about that in the comments later, but we'll save it for now. It's a really exciting point in time for this project, and we're really ready to see what's moving forward. So I'm going to hand back over to Chris just to talk as our executive sponsor and as one of our strategic working group members about very briefly his vision for where we can go in this space. Thanks, Chris.
Are you there, Chris?
Yes, I am. Thank you. Can you guys hear me?
Yes, we can.
It is quite disconcerting when your computer's completely frozen. You're just you're going by feel. But thank you, Brandon. That was such an eloquent and amazing description of some of the amazing achievements that we have already delivered upon within the Pride at St Vincent's group. Look, I think the future for us is bright and it's exciting. I really hope that we can continue to support and develop the legacy of St Vincent's relationship with the queer community, as was first established with those amazing leaders who we discussed earlier and their work in HIV and AIDS. The Health and Wellbeing Index is a really exciting piece of work for us. It allows us to measure just how good we are, and not just how good we are for our staff, but just how good we are for our patients and the community in this space. This is something that we look forward to improving on year on year. And there's so many exciting things coming up down the pipeline. So really for us, we want to continue to grow the membership. If you're interested or you know someone who might be you an ally or a member of the community yourself, reach out. We really, really welcome you, and we look forward to continuing to make St Vincent's a safe place for all people who want to work with us or see us as their hospital. And thank you, Linda. I'll pass back to you.
Thank you, Chris, and thank you also, Brandon. I'm proud to say that St Vincent's Current Foundation has made a commitment to provide support for this Pride initiative. And of course, we continue our fundraising support of the work St Vincent's does for HIV positive patients who'd otherwise be unable to access the treatment and care that they need. I'm very pleased to introduce our next speaker, who is the art curator at St Vincent's Health Network Sydney. It's a relatively new position that was funded through St Vincent's Current Foundation, and it's really exciting to have Alice as part of the hospital team. She's going to speak about a very significant recent art acquisition and also about 2 exhibitions on level 4 of the hospital. So please welcome Alice McAuliffe.
Thank you, Linda, and also thank you to Andrew, Christopher and Brandon for sharing that incredible history and the ongoing work in this space that St Vincent does. It's amazing to hear about and be a part of in some way. So as Linda said, I want to talk to you about an acquisition and a special project that's taken place in the last year. And the image that you can see now on the screen is by William Yang, titled Allen, Ward 17, St Vincent's Hospital. And now this image was originally part of the 19-image series Allen, taken in 1990. So the full suite of 19 images documents the journey of Yang's friend Allen while he's intermittently treated for HIV on Ward 17 South, during healthy periods socialising in Darlinghurst, and as he dies of AIDS-related illness at Sacred Heart. This singular image was chosen as it captures Allen in Ward 17 South enjoying the hospitable care of St Vincent's, surrounded by some of his personal objects. Now, William kindly agreed to print just one image from the series for us, understanding how important this was to our art collection and our history. So I wanted to personally thank William for allowing us to do that. Another project that we've undertaken this year, the Art Committee and myself, is to commission the architectural photographer Richard Glover to record Ward 17 South in its most recent disused state. The series portrays Ward 17 South as a site of memory, which holds many stories. Glover hones in on architectural features such as hallways, windows and lifts, alongside poignant details indicating time passing, dust built up on air vents or marks and discoloration on walls from past use. The series frames the ward as being a component of the Cahill building, which in turn is part of its surrounding environment, imbuing the space of the ward with social agency within Darlinghurst and the communities of sexuality and gender diverse people who have been connected with the area and the hospital for many decades. Past patients and staff from Ward 17 South and members of St Vincent's sexuality and gender diverse communities were asked to choose the 3 most poignant images from Glover's series for exhibition. Now, these are currently on display on the level 4 mezzanine of the main hospital alongside William Yang's work. So for those of you who are able to have a look at those and go into the hospital, I encourage you to do so. We'll provide a link to the full 28 images so that in the chat, so that if any of you would like to have a little bit more time to look at these a bit more closely, you're welcome to and you'll be able to. Also on display in the mezzanine and along the corridor towards IBAC and the private hospital is the exhibition HIV is Just a Part of Me. Now, this was produced by the National Association of People with HIV Australia, and this will be on display for the following week from today until next Wednesday. So as I said, if you can get the time to go and have a look at these things, I encourage you to do so. Thank you.
Thank you, Alice. It's amazing how evocative and moving those images are, and yet they don't have actually any figures in them, but they're incredibly moving. Now that's our speakers for today, so I'd like to again thank Alice, Andrew, Chris and Brandon. Today's webinar has of course been recorded and we'll be sending a link out. It'll also be available on the Foundation's YouTube channel and on our website. And I also thank Christopher and Hayley for pulling this together when we couldn't go ahead with it as a live event. So thank you everyone and enjoy your afternoon.